Today, Ohio saw 885 new cases of COVID-19 across the state. It is the highest daily total since April 20th. That spike comes as health officials are increasing the number of tests administered around the state. And Cuyahoga County is doing the same, today pledging $5 million to increase testing countywide.
But as 5 on Your Side investigator Scott Knoll explains now, that still does not mean widespread testing for everybody.
The $5 million is expected to translate into about 30,000 additional tests, much of it aimed at specific groups in the community considered most at risk.
Testing, testing, testing.
A lot more of it coming to Cleveland and Cuyahoga County. The goal, to get 2,000 people a day tested for COVID-19, not only to identify who has the virus, but to stop the spread.
The intention is not to test every single person and everyone in the community. That is not the intention. We're focusing on vulnerable populations.
That means people living and working in group settings, places like nursing homes, homeless shelters, and group homes, where health officials say the risk of transmitting the virus is high, in places where testing hasn't reached yet.
The sad numbers of infections and fatalities are skewed by the hotspots.
An analysis by 5 on Your Side investigators shows more than 1 in 5 of Cuyahoga County's cases since mid-April are connected to long-term care facilities, and more than 100 cases since April tied to the county's jail. Metro Health CEO hopes by identifying those who are sick faster, patients can quickly be isolated to limit their contact with others.
These clusters, as opposed to large communal spread, will be driving the infection rates across our community in the coming weeks and months.
A strategy aimed at not only protecting those inside these facilities, but the entire community too.
The idea here is that if you have staff in congregate facilities that then become exposed and COVID positive, they then potentially circulate out into the community, into their homes, into grocery stores, into other places where they may work, and begin to spread and create new chains of transmission that cause further cases and fatalities.
The health department says it's still working to identify which facilities will be prioritized for testing. That includes the possibility of the county's juvenile detention center, where last night the county confirmed a teen tested positive for COVID-19. In Armond, 5 on Your Side investigator Scott Knoll.